This week, we learned Bruce Willis will be retiring from acting after he was diagnosed with aphasia. It's a condition that impacts the part of the brain that handles communication. Our 9Health expert, Dr. Payal Kohli, is joining us to talk a little bit more about this. What is aphasia? How common is it? I think some of us have heard of it, but don't always connect the dots to the term.
About 2 million people in the U.S., Kim, who have aphasia. And aphasia just means an inability to produce language or to comprehend it. So it's the part of your brain that's involved in language processing. And if you think about what we do when we use language, we speak. So there's an expressive aphasia, where you have trouble speaking, and we listen. So there's a receptive aphasia where you just keep talking, but you can't understand what people are saying. And then there's trouble writing and reading as well.
Okay, so there's various forms of this. I mean, many of us, I think, tie it to like stroke. Sometimes you'll see somebody recovering from a stroke and it's that same kind of thing. You see how frustrating it is. They know what they want to say. They just can't put it right out there.
Incredibly frustrating. Most common cause is stroke, but it can also occur from brain injury, from brain tumors, from neurodegeneration, from infection. So there are other things that can cause it. And people can have different severities. So there's some that just can't talk at all, and some that just maybe mix up words once in a while, mess up their grammar. And interestingly enough, some people may have trouble, for example, asking their family member when their birthday is. But if you ask them to sing happy birthday, they'll be able to do it.
To sing it. So when you hear about something like this, and someone like Bruce Willis that we all know and recognize, what's the prognosis, the treatments? Are there treatments out there?
Very challenging condition to treat. There are not a lot of good treatments. And essentially the way you treat it is by treating whatever the underlying cause is. You can also connect people with speech pathologists that can teach them how to communicate kind of around the aphasia or how to kind of learn to overcome it. The most amount of healing occurs usually within the first few months after diagnosis and really plateaus at 1 year. So after that, you don't always see a lot of improvement. So it's a really difficult condition that takes a big toll on the patient and also the family members.
At Craig Hospital, sometimes I've done some stories with people that were brain injury survivors, and they talk about, they do such extraordinary work, but we don't really see the brain. So, we always think, well, can't you do something, treat it? It weighs on you mentally too.
It completely does. And if you think about language, it's such a big part of how we communicate with each other, our personality, and also we have found some new data that people who have aphasia may also have trouble with cognitive function and executive tasks because we use language to organize our thoughts, to organize our day, to get things done. So it's really challenging, and the studies have actually shown that it's not just the person themselves, but their family members whose stress levels really spike up when they're diagnosed with aphasia.
I guess the only bonus is when something like this happens to somebody well-known, they acknowledge it, and maybe there's new clinical trials or research or something that comes out of it.
I think awareness, understanding, patience, and like you said, shining a spotlight on the condition so we can really try to work and focus on how we can try to improve outcomes for patients.
Okay. Thank you, Dr. Kohli. Tom?